history?
Mhm. Well, let's see if anyone's here so far. It's going to be a nice little personal conversation. Let's get this here. Oh, who's that? AJ. Let's see who's that. Hello. We are having a conversation for two. Yeah. Hello. Hey, hello, Professor Sasa. This is excellent. I hope that you come on with me. Like, I'm going to try to do this every Tuesday night because someplace, somewhere, there's a nursing exam going on a Wednesday. So if at least we could just come on and just give these students just a little bit of positive, calm energy, just to remind them that we do understand, and despite what they think, we are actually wishing that they do well tomorrow. So we'll see. So I did this AJ, who's that? AJ, hello. AJ, are you a fundamental student, second semester, senior? Where exactly are you? And Professor Sasa, do you have an exam tomorrow? It's just lucky fundamentals. High school dropout, no such thing. Not a dropout. You reconsidered. You reconsidered. It's next week. So next Wednesday, Professor Sasa. So again, we'll do this. I could set this up. We'll do this again next Tuesday night. Awesome. So Tuesday night, same time. Normally with the students, I tell them after 7 o'clock. I don't have a relationship with them, but I figure there's some evening students. So we'll do this again next week, and you're coming on because they're going to ask those questions. And that's why I put it this way. Of course, ethically, morally, I'm not going to tell you what's on the exam. I can't. I wouldn't. But if the students, sometimes they have a last minute question and they want some clarification. So that'll be nice that you're on and we listen. So back to AJ, high school dropout, no such thing. You had to reconsider. You have, it's life is like your health. You start out good, you may step back, you go forward, you may go different directions. So do whatever you're doing. So high school dropout. So what are you doing now, AJ? Hanging out on a nursing education tutor channel. Is nursing on your radar? Science? Or maybe you're going to be the next Supreme Court judge. There's a vacancy. I hate high school. I'm doing art. Okay, high school is not for you. Okay. Do you contemporary landscapes? Are you a Van Gogh or Renoir or a Matisse? Or none of the above? Or an Andy Warhol? So Professor Sasa, your first exam is on what? Is that med surg? Is that saw a comment of yours in a video I watched, you're a queen. Oh wait, oh AJ, watch the crown. Oh, you know it. Look at that. Just put on the crown. Thank you for that. Thank you for that. My art is jazz. Ooh, Freud. Ooh. I'm gonna have to. Do you have any art on your channel? I'll go check it out. I love the arts, more performing arts. I mean, I do have an appreciation of the visual arts. I've been to the Louvre. I've seen the Mona Lisa in person. I mean, it's probably this small compared to the other stuff that's there. But I don't have any on my channel. Med Surge, this is great. Yeah, please do. Oh, that's awesome. And Randall, I think that's, like I said, this channel was not my idea. It was the students encouraged me to do it. And my goal once I started it was to do just this. My goal was to get enough subscribers, 1,000, and 4,000 watch hours in order to go live. I mean, I'm going live from my laptop, but you need that to also go live from your device. So I've reached that goal. I mean, I didn't set out to make any money from YouTube, but I've gotten a check. I've gotten some dollars. Crazy that they've paid me to do something I like. But so Professor Sasa, so while you're here, and excellent. So my vision for this as it grows is that, so let's say next week, I'm going to try to do this every Tuesday, because like I said, almost every Wednesday in some school across the great country of ours, there's some nursing exams. So I figured if I do this on Tuesday night, it's my platform, but you, Professor Sasa, could be in the chat, another professor. So if they ask me some question like, I don't know, one of the different hepatitis, you know how crazy these students get on Hep A, B, and C. And, I could answer that, but somebody else could answer it in the chat. And I think this is how we build a community. And I would like to sit in on content that I don't teach. I mean, there's some contents I don't really want to, but it's very refreshing. So AJ, I'm one of those people that feel so at home at school. Oh, I was that student. School was my savior. But that's how we do. Yes, Randall, I got some. I made two videos actually to tell you how, as I talk to my students about current events, I teach that you must be aware of what's current. So of course I mentioned, that the Supreme Court has a vacancy. As a nursing student, you should be aware of legislation. You should know the three branches of government. You should, whatever you're feeling. I mean, I don't make it a political issue. To me, it's a health, it's a business, a professional issue. So when COVID, interrupted our lives, I saw all these people putting up videos on YouTube about making a mask. And I was like, hey, I crochet. I'm a nurse. Crochet mask. I've been crocheting for forever. I have never, ever made a tutorial because people that I taught, I would teach in person. So I made, you should go look it up, how to crochet a simple mask. I could pinch myself because that one video that I put up, I think in April, has over 165,000 views. Ridiculous. I saw this video, even if I didn't crochet. Randall, the funny thing about that is, who you are will always come out. Had I made that video 20 years ago, it wouldn't have been as good. That video I made, I thought was good because I'm an educator. I know how to teach. I know to do simple steps, and I know how to do repetition. I'm not sure if I would have done that well then, but I'm happy about that. So I was more excited about some of the comments that they gave. So that was one video. I could teach you how to crochet though. Another video that I made. Oh, I have somebody else on the line who just came on. Introduce yourself. We have a party of 4 going on. So say hello. The next video I did was, and I just did it at random. It was about that nurse that quit again. It's nice to think, I'm not going into a patient's room without proper PPE if they're known or suspected to have COVID or a flu or TB or any of those type of respiratory airborne droplet type of precautions. So this nurse in Atlanta, I believe, she had resigned because she didn't feel that she was exposed, or there was a patient with COVID and she wasn't informed. Cut a long story short, she decided that she was going to quit. And I decided that I was going to make a video, and I did. Around the same time with the mask, I made a video just to give not an not an editorial. I mean, I probably did state my opinion at the end, but the beginning was just really to state the facts that, what would make this nurse quit. And part of the reason she felt not only was she exposed and wasn't told, she was worried that she would work with other patients, and in the event that she got some exposure, she wouldn't be able to quarantine because she had two children, her husband lived in another state, and whatever. So I made the video based on that, and I threw the question out. So that was also a very good video. But what really moved me was that, to tell you what an amazing connection just a platform as YouTube, Instagram, Facebook, or all the others can have. That nurse that I wrote that video about actually sent me a message and thanked me. Something to the sort of, there's a lot of people out there talking her business and don't know. And she thanked me for stating the facts. That was enough for me. And again, that's really how I wanted to do that. So, c'est la vie. So, Randall, I'm telling you, so Professor Sasser, so next Tuesday night, 8 o'clock, all your students are going to be on here. Be ready. I have a notepad ready for their stuff. I have my camera over here because 102, they're really, we're up to 5 people. Whoever just came on, please introduce yourself so we know. Don't be shy. Don't let me have to go check and see who you are. Just say a quick hello. We're just really just talking about the purpose of the channel, and that's it is growing. I'm really happy. I'm really happy about it. I mean, when I hit 1,000 subscribers, I was so happy because that was my goal. You can't do anything, and you can't do much in YouTube for free unless you get to that 1,000 subscribers and 4,000 watch hours. And that one crocheting video pushed me over. Again, lesson to everyone. As I'm learning, I learn from these young YouTubers. Even as simple as you see the thumbnails that I have, I looked at a lot of people's videos and I noticed, and I watched a few tutorials, you have to keep your thumbnails consistent. So one day I kind of made one with that slant thing and I kind of liked it. So I just changed the colors around. So it's just really important that, they mention, be consistent. They also say be consistent in uploading videos. I really didn't do much this summer. Just life kept me away from social media, and I just want to be truly genuine. So, school is back in session. The amount of lighting stuff, I mean, that I go through. I'm learning how to do this lighting stuff. I'm actually just in my dining room, nothing major, but I got a light over here, light on the ground. I watch some of these videos and get some tips from them, what to do. Daylight is best to film inside. Normally during the daytime, I film near a window. Nighttime, they tell you how you get rid of the shadows. If you have one light on one side, put another light on the other side, and that Randall. So I'm happy. Goals for you, Mike. Definitely. It's coming along. It's coming along. So I don't see your exam is next week. My art student is there. There was somebody else here, but it's just us. So we'll just chill and relax and see. So let's see what else is going on. Odin's convention is coming up. It's all virtual. It's less expensive. Some of the topics are current and other stuff in the news. So I don't know. Let's see. Professor Sasa, is your exam soft remotely like the rest of us? Or what are we doing? Good luck. Zoom. We're all working through it. We're all working through it. I had issues with ExamSoft. It wasn't. I can access it. I get into their stuff, but the assessments that we have, I couldn't go into edit. So, we're gonna work through that. And are you going to the hospital? Have you signed that waiver that in the event you get COVID, you cannot sue the hospital? First time to do. Same thing for us. We did a practice. We did a practice exam in ExamSoft. a couple of days ago, and so these are some of the issues. Today's what, Tuesday? Last Wednesday we did a practice exam last Wednesday, and some of the issues that we had was it kicked the students out of Zoom. So I'm not sure if your semester did any practice. So that's just been our experience with that. I know my experience with Zoom. We don't have a choice. I know, right? Is that crazy? I saw the waiver. If the student refuses to go or chooses, then they can get another semester. What if the faculty says we don't want to go, Randall? Do we get a semester off? I laughed. I laughed when I saw that. I'm like, I don't know. We have to go. We just have to be extra careful. um this whole mask thing drives me crazy, to be honest with you. But the only thing that I think about is, flu season is coming up. Flu season is coming up, and I'm thinking the mask will minimize the chance of you getting the other stuff, common cold or the flu, and of course double check with COVID. But the mask, it's quite difficult to work with. And I know people think that we're whining, but I mean, your nose gets annoyed. I mean, my glasses fog up, I'm breathing heavier, I'm talking louder, nobody can see my smile. There's some nonverbal things that accentuate a conversation. If your face is covered, it's I guess we realize just how much. It's not just speaking; they can hear you. There's more to communicating with your mouth than just words. Just a smile, a frown, nothing, apathy, and we're learning. I see this now. I just hope people still do good mouth care behind that mask. That's the exactly. I do hope. There's so much more than just words. I saw a little boy. Again, I guess it's just like every other sense. I'm sure, as it's well documented, somebody who has poor vision often has better hearing because they focus more on that. So I find with this mask, I'm being overly expressive with my eyes, and talking louder. Yes, I saw this little boy, and he was in a shopping cart with I assume his caregiver. And he was just so cute. I don't touch people. And I'm like, hello. And I'm thinking he can't even see my face. So I actually said to the mom, I'm smiling. I find myself saying, I'm smiling. So I don't know. I don't know, Randall. I'm missing some of the smiles. Oh, there you go. I'm smiling. Look, I mean, we should smile, and we have a staff meeting tomorrow, Professor Sasso. Wish us luck. Wish us all luck. I just hope people stick to the agenda. Don't go off topic. You know me. Focus, focus. Especially when it's close to the end of the meeting. I don't want to hear anything new at the end. Bring it up. So, Professor Sasa, so next week when I do this, give me some, since I love that this I did this last week. There were only two students, and I loved it. It was great. There was some high school student named Osha. How the irony of that, the YouTube name was Osha Fudge, OSHA. I'm like, do you realize that OSHA, what it means? And I talked about asepsis a bit and hospital guidelines. So, Professor Sasa. So for next week, and I do this Tuesday, anything different since it's your group? I would like you to invite. It doesn't even have to be somebody just from our school. It could be from some school in Louisiana. You mark my words. In a couple of months, when I do this sucker, we get more. Oh, we will. Oh, we will. And if it's a few, it's a few. Sometimes you have a small dinner party, a nice intimate gathering, and then another time you have a Filipino party with like our Cuban party. So, but yeah, so they will. I guarantee you, if you, I guarantee if you say that, you know what. I mean, don't tell them it's me. I mean, I don't know what's on your test, but you're just using my platform, and Some of your instructors are going to be online to answer your questions, and that's really how I put it out. You know how we don't care, for instance, like, is that on the test? Is that on the test? Most of what we teach you, students, for those listening, it's not on the formative exam. It's actually information to help you make in clinical judgment, decision making, analyzing a situation, how to proceed, when not to proceed. Most of if it when taught properly and when learning occurs, because two things have to happen. Most of what happens is not tested on some multiple choice exam. I can tell you right now, a lot of what I learned and used for decision making wasn't even done in nursing school. Probably stuff that I learned, in life. Um, Decisions that you make and don't make anymore. Watching somebody make a mistake, see the consequences for their behavior, and you recognize, well, don't do that behavior if you don't want that consequence. But of course, theory connects to practice. So yes, some of what we teach you um, will be on your exam. Your school, whether New York or another state, have to satisfy your board of education, your state board of education, that you have met certain competencies, met certain objectives, and we have to measure that some shape or form. And the easiest way is in some multiple choice item, because I do not want to read 30 essay papers like they do in other schools. I have a cousin she's a vice president of an agricultural college in Jamaica, and like their papers, it's a paper. I'm like, you read paper. So I don't complain. I really don't complain about our testing, but I don't want to read 30 essays. I mean, there's still some subjectivity to that, but anyway. So that's the story. So that's the story. Oh, Professor Sasa, look at that. We have 5 people that are intimate, and test taking plays a major part. Yes, exactly. So whoever came on, so absolute test taking, let me tell you how I put it. That Jeopardy is my favorite game show. Is my favorite game show. And people look at these individuals on Jeopardy. So Professor Sasa mentioned something about test taking. I would mention something even before you do the test taking. I was one of those people. I didn't have a photographic memory, but trust me, I used to be top speller. I could memorize anything, and songs, books of the Bible. I could recite them all. But to me, it starts with process, how you store it. It's how you store it. So when people use these acronyms, a teacher tells you a paragraph, the ability to store something, that's one way. The ability to retrieve it, oh, it's Jeopardy way. So what part of that is smart? It's a lot of that. So when Professor Sasa mentions about that, test taking is an amazing thing. It's difficult to do that now. And of course, always with test taking for students, there's this element and potential for, not always, there's a potential for cheating. And we always have to address that. Because you want students to get a grade that they have earned. I don't talk about, oh, the teacher failed me. No, the teacher didn't fail you. The passing was, I'm going to pick a number, was 80. And if you achieved it, then you earned that. And if you didn't, you did not. But so I remember when I used to take exams, I swear, this is what I used to do, paper. I would, the teachers knew me. I was a good student. I was a good student. They weren't watching me for cheating. But what I would do, and I remember once I actually told a teacher that this is what I did because I didn't want any assumptions. So of course you get into, this was paper. It was, we did have pen and paper. We did have pen and paper. But I remember telling the teacher, I said, what I like to do is when I come into the exam, I would just like to take a blank piece of paper before I start the test and just basically download. I was like going up to the cloud, and I would just write down everything that I could remember. So again, if they see you writing, so most of my colleagues, the teacher, they're like, okay, it's 9:05, you may begin. And a lot of them would start taking their test and everybody's taking, and I'm just sitting there taking a few minutes. I'm just writing down. So I'm just figuring, let's say it's an anatomy class and I'm writing down RNA, DNA, I'm writing I'm writing the sugar, I'm writing the base, I'm writing every single thing that I could get out of my brain on that piece of paper. And I didn't time myself, but I knew I studied. I never walked into an exam unprepared. I studied. I mean, some nights I studied more than others, and I was a good cram. I'm like, okay, I'll cram. But I would write everything down. And then I'd get to question number one. And then I just kind of look, but sadly, because of cheating, the few rotten apples that cheat, teachers don't even allow you to do that anymore, and those type of stuff. So that was always a good way for me. um, I didn't write a lot of things in notes, and I think partly because I had a good memory. But what I would write, if let's say the teacher is talking and whatever her name is, and I'm like, oh, she talked for 10 minutes on this topic, I would write that down in my note. I think this is important because she talked for 10 minutes on that topic. Then I'd listen again. So that's honestly, I would write stuff like, I'm like, oh, she went on and on and on and on and on that. Maybe I should read a little bit more. Or she barely brushed on that. Or he, that's kind of how I did. So thank you, Professor Sasa, for that. Test taking plays a major role. Test preparation. So, like, here's tonight. I'm a faculty. I'm not taking an exam tomorrow, but here I am. I'm thinking about your exam. I'm concerned about you that you're doing well. We could tell you till the cows come home to get a good night's sleep. We know most of you are not going to get a good night's sleep. We all talk about that. We tell you that tonight, the night before the exam, you should have finished all your reading. And I guarantee you tomorrow, if the exam is at 10 or 11, there'll be one of you sitting right outside, well, now in your home, reading. You're just reading. I always tell you, there comes a time when you must close the book, whether physically, like, when we're in person, or digitally. There comes a time when all you're doing is reading. It's like, you ever have a teacher and they just read word for word for word from the PowerPoint, and you're like, well, why am I sitting here and I could be home reading word for word? It's like yeah, thanks, Professor Sasa. When I go to a convention, and I go to a session, and I'm sitting there, I'm a student, I'm a participant, and they're just reading. So at some point, you have to close your textbook. I talk to myself all the time. Perhaps I need an intervention, but I do. I'll close the book and I say, okay, Cheryl, what do you know about COVID-19? Without looking at any website. And I'll just go through my head. Okay, so COVID-19, I know it's SARS-2 as opposed to the first SARS. And I'm like, and the doctor in China who alerted them and they didn't pay attention to it. And the Center of Disease Control, at first they said that it was droplet only. Then it was changed to airborne. Oh, that makes sense. I talk myself through that. And then I go and try to verify some stuff. Okay, what is Joint Commission? Fundamental students, you talk, what is Joint Commission? Oh, the professor, so Joint Commission is, well, Joint Commission is kind of like the state, like when the states come into, I tell students that it's like the state is coming to the facility. Well, the Joint Commission is bigger than that. So the Joint Commission is the person that hospitals must satisfy. They set the standards for a lot of things in the hospital. If a fundamental student, you can say, I'm not 100% sure, but let me go see what Joint Commission does. Joint Commission is involved in a lot of things. And I put it simple just like that for the hospital. Joint Commission has national patient safety goals. Oh, I forgot about those. Well, what are national patient safety goals? And I gave students this example, Professor Sasa, that, very few people sit down and go, oh man, life is good. Let me change that. It doesn't work that way. Many times something has to happen. And so that's what happens in healthcare. Many times for some drastic change, something untoward bad had to happen. So when you look at a lot of your national patient safety goals from Joint Commission, it's because something happened, like patient identity. Like, okay, so here's an example. So when you get to peri-op, um, the person who identifies the site identification has to be done either by the surgeon or one of his or her associates, would be another surgeon. And the only reason they do that is because previously wrong limbs had been amputated, wrong breasts have been taken off, different. I mean, I swear, I remember back in the day when the patients were going down to surgery. I'm just going to rip a page out of this book. Patient was going down to surgery, and if they were going to have surgery on their right arm, they would have a piece of paper, laminate with the letter R on that. Professor Sasa, do you remember that? Well, you're younger by this much. We used to put like an R or an L. I mean, I mean, how ridiculous was that? You know, we shouldn't be surprised. There you go. So luckily we don't do that anymore. I actually, who's the other person here? Just put a note in the chat so I know, so I give you a shout out and wish you very well on your test tomorrow. I talk to my students about heparin. And it's a story. I mean, you know, some of them, they're so young, they don't know this actor, but I think there's an actor by the name of Dennis Quaid, one of the Quaid. I think, yeah, Dennis Quaid. Yeah, Dennis Quaid. There's a Randy Quaid. Dennis Quaid had twins and they were in the NICU in some California hospital. I don't know if you know this whole story, Professor Sasa, but Dennis Quaid, webcam lighting, Dennis Quaid had twins and they were in the NICU in a California hospital, and the nurse was giving the wrong concentration of heparin. So instead of giving the 1 to 100 Heplock, the nurse was given a higher concentration. How they figured something was wrong, these two little babies, and the babies survived. They're big now. No, there you go. No, look it up. No, the babies didn't know. You have to look it up. Look it up. It's a good story. It's a good. I teach them all the time. Oh, the kids, they must be big. They must be big now. But what happened? Of course, the babies, they get all little injections, and the bleeding wouldn't stop, and that's how they found out that the nurse. So every time you see, so that's one of the reasons why Joint Commission recommended a lot of these. We don't want any bedside preparation. These high potent drugs away from the bedside. So that's why every time I see a heparin concentration with that sign, I teach my students about that. And of course, we don't want any IV potassium at the bedside. So again, Joint Commission didn't decide to change that because things were nice and sunny. Something had to have happened. So I teach them that, Randall. Let me just see. I think it's Dennis. There's a there's a Randy Quaid. It's a good lesson. It's a good lesson, and thankfully they survived. But let me tell you, I remember back in the day, 2007. It happened in 2007. Yeah, 2007. Let's see. How a medical mistake almost killed Dennis Quaid's twins. Yeah, so I use examples like that, Professor Sasa, when I do, because of course, everybody can Google. Once they Google something that you said and it's official, they're like, she knows what she's talking about. But I'm happy that Google makes us honest. Yeah. So instead of giving 1 to 100, oh good Jesus. They were pushing 10,000 units into the Ivy lock. Can you imagine? Thank goodness for medicine. But so luckily that happened, and yeah, sweet Jesus. Oh yeah, so that's the actor right there. That's Dennis Quaid. Let's see. Dennis Quaid. Dennis Quaid. Yeah, so I maybe that's why there's a little chuckle in my class, but I let them look up stuff like that. When we talk about, let's see, now who else is here? Say hello, somebody. Good luck on your exam tomorrow. So I'm about to tell you what's on the exam. Are you ready? It's all in your head. You know it. You've studied. It's there. You've prayed about it. Um, you've had opportunities to think. uh, um, yeah. So when I'm talking about advanced directives, I usually to be this is an old case. This was from when George Bush W, the second one, was president. And I bring that case up again. It's about a young lady by the name of Terry Schiavo. So Terry Schiavo was married, and I bring that up very early for students to understand professional issues. You need to choose. Once you're married, your spouse is your next of kin, whether your parents like it or not. And I speak. So this was a case about this. This lady was married, and there was some little family issue. So there was some suspicion she fell at home, basically was in a long-term place on, they kept saying a vegetated state, and we could debate what that looked like, but she was nonverbal, not following any commands, was on a feeding tube and whatever variation. The husband stated that he didn't think that she wanted to live like that, and he wanted to remove the feeding tube. The parents didn't want that. The parents wanted, and it just got so political where George Bush got involved. I'm like, I mean, you have executive power, but not over human body. And even my own sister who is a nurse, the two of us, we disagree on that. I remember one day she made a comment and she said something about, well, no man is ever going to keep my family away from me. And I said to her, well, be careful who you marry. Because as much as whatever my personal feelings, legally, the husband was her next of kin. And that's how the courts, hey, that's how the courts ruled. And she lived a couple months and then she died. And so I use an example like that to talk about professional issue. Yeah. You about be careful who you marry. Yeah, to love, honor, and make my healthcare decisions. You better pick them carefully, boo. um, and I talk about that. So I talk about that healthcare issues. I even give another example. I won't mention I don't mention the name because it's a small world. But I knew a nurse, and that nurse was married, and she knew that her husband wouldn't be able to make a tough decision regarding her life, and her best friend was her proxy. And sadly, there was an incident where that proxy had to make a decision, and it was the husband was okay with that because they talked about that. But it's c'est la vie. So Professor Sasa, I bring current events to class all the time. Leadership. Shout out to you, Delta Nu. We have an honor society. It just makes it so tangible. I think when you give students or even human beings an examples, it makes it look more attainable as it is. I like to tell students, it can be done. I mean, I don't go through, well, you do it, I do it. No, it took a lot of work to do it. But I'd rather say, see that professor down there, yeah, they're doing that. You can do that too. And I'll show them people on TV, and I'll go, I know them. And they're like, you do? I'm like, yeah. And I'll show them the picture. And they're like, wow. And I'm like, don't be impressed. They're humans just like you. They're humans just like you. Um, in 2016, I'm trying to figure. Let me just see. In 2016, yes, in 2016, the presidential race, out of the, oh, excuse me. Oh, let me just see. Business. Could I call you back in about 5 minutes? No, no. Give her in the morning. Let her go to sleep. Yeah, I'll talk. Yeah, sure. Um, where where was I? Randall, where was I? Yes, real world examples to make the topic. Oh, yeah. So in 2016, my I don't, 2016, all those people running for president of the United States of America, I knew and know three of them. Not telling you which three, but it was just, and I think it's important, so students, there's a thin line. You want maintain professionalism, but you show them certain things and bring them to certain websites and even profession. So I have, oh yes, oh yes, Randall, yes, 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 yes. Then it came down to two people. Then it came down to two people in 2016. Hmm. I won't tell you if the three are part of that too, but c'est la vie. Poker face. Poker face. Poker face. So Professor Sasa, so these are goals. Yes, 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 yes. These are goals. So I think we're doing okay. So what do you think about this format, sir? I think this is good. Next time I'll do it in the other room. I was just doing some lighting, make sure I see lights, lights, lights. Look at that. Lights. Randall, I'm telling you, I've mastered the lighting. I watched a YouTube video and they gave me a nice tip. They're like the best way to get rid of the shadows is if you have one light on one side. Yeah, make sure the light. Okay, let me just move this one to show you. Look at the difference. Just watch. Do you see the difference? Just having that one light away. Look, yes. I approach everything like a student. I approach everything like a student because we can all learn. And I watch some of these young YouTubers. I watch Patrick Starr goals. I love him. I love him. I can't believe this guy puts on makeup the way he does. I love him. And I do go in some of those other nursing student videos and just, I just go on, I'll say hello, and of course they'll see my name that I'm an instructor. I just wish them, positive thoughts, good luck on your exam, come over to my channel. But I don't do the whole begging for subscribers, but I find that so annoying. But I guess that's part of the whole YouTube thing. I mean, some people make that as their living, so they definitely want people to come. I have it. I'm happy. Like I said, YouTube gave me a check, and hopefully I get some more checks, make some money in my sleep. But it's the whole purpose is something like this, where education is free. I mean, free in the sense that you have to work for it, but you don't have to put a dollar. So, Randy, I think next week it's going to be popping. Or what's the term they say on the street? Snatched. learning these terms is crazy. You're positive, yeah. Yes, thank you. Even I'm telling you, first it was lit, then it was on point. Now it's snatched. And I find myself going, period, with the T at the end, like there's no T in period. But just you can relate to them on their terms. So, even if a student next semester, so I'm telling you, you spread the word, Professor Sauce. I think we'll stop. You spread the word, and you know, and they bring the questions. They always have questions. They do. The night before the exam, they stress themselves about this one question, and they spend so much time. And guess what? That topic is not even on their exam, but that just throws them off kilter. To back, as you say, so. Of course, they're going to ask us the questions like, well, is hepatitis A on there? And our pre-programmed answer is it's part of the reading requirements. It's like, honestly, this is what I usually do in lecture. I tell them, I said, everything is important. Some things are much more important. And if it is, I'll pull my ear. And I do. And sometimes if I see them, they look like they're like bored in class. I'll just go like this. And like, Professor, did you pull your ear? I'm like, well, that's for you to figure out. But we have to be honest with them. We really have to be honest with them. It's like algebra. For the love of God, I mean, how much algebra is really needed in everyday life? I mean, x squared plus y squared equals How about you go to Walmart? You go to Walmart and you have $100. And when you get to the register, your bill comes up to 110. I know it's, oh, please, rite of passage. If what you went through, what we went through, it's, I know it's really like a rite of passage for like, are you smarter than a fifth grader? I mean, a fifth, you know? So, we do need to give them some more critical thinking. So, like I said, you're at Walmart, you have $100 in your pocket or in a card, your bill comes up to $110. I do an example like this with nursing process because let's what the patient has 5 complaints. The nurse has to decide which of the 5 complaints is addressed first. Nursing process happens at every Walmart, every register. Your bill is $110 and you only have $100. Well, guess what? Something has to be taken out and put there. So now you have to figure, well, everybody in my family has eggs every day, so the eggs stay. That Entenmann's marble chocolate cake that looks so delicious, as much as I really, really want it, those are the decisions that you have to make. Those are the decisions you have to make. So I think so. Some of those stuff. So when students ask me all the time, Professor, is that on the test? I mean, they know me. I will tell them straight up. If something isn't, I will tell them honest. I'll tell you that now. I'll say it in front, Professor. Exactly. Prioritization. So those are some ways that I teach them fundamentals. I had the student, I'll end with this one. I had the student a while back, an older lady, she was older than me. And, nursing was her third career. And I was trying my best to teach her how to prioritize and plan. And I don't know how it came to me, but it did, and something I used before. I was trying to explain to her how a nurse seldom has one thing to do. A nurse seldom has one thing to do. I mean, a nurse minimum has 2 things, has to decide what can be delegated to someone else or what can be put off for later or what needs to be done now. So I don't know, it came to me and I've used it since. So I said to her, it was something similar to this. You have a patient who needs an antibiotic. Patient needs an antibiotic, and another patient needs their blood pressure medication. Blood pressure is normal, but the patient is due for their blood pressure medication. I couldn't get her to understand why, while both those medications are due at the same time, that hanging the antibiotic was what she did first, and then the blood pressure second. And I emphasized that the patient's blood pressure was stable. It's just the medication that's keeping it there. So I said to her, I swear, I said to her, and it's one of those things that, shame. I said, you're home and you have to cook dinner and you have to do laundry. Tell me how you're going to do that. Oh my goodness. She was like, well, I'm going to turn on the washing machine and put the clothes in there in the soap because the washing machine can do itself. And while that's going on, I'll go in the kitchen and I'll make dinner. Swear to you. So I was like, consider the washing machine the antibiotic, the IV antibiotic. And it was like a light bulb that went on for her. So that's why I really try my best sometimes to try to find some everyday normal things. I can tell people, I mean, I don't know why we call it nursing process. Exactly. Yeah. Relatable, something she can use again, reliable and relevant. You like my R's? Relatable, relevant, and reliable. And so it was just stuff like that. Now, we can talk about it all the time. Practical and relatable. You're absolutely right. Absolutely right. Well, Professor Sasa, this was an excellent conversation with you. I'm so glad I decided to send that email out to you. Let's see who was here before. AJ, whoever left, good luck in your art. So we have a date, Professor Sasa. And if you invite some other people, they don't have to be They could be from any college, any student. I would like to do this every Tuesday night next week. 8 o'clock, I think, is a good time. I do post some other videos sometimes in the morning, but I'll just try to keep this live at Tuesday night at 8 o'clock because there's not much going on partying. What do you say? Um, I have a feeling, I always plan ahead. I have a feeling once it start to get better and bigger, I, I'll designate some wonderful nursing students to just keep track of the questions because if let's say they ask a lot of questions. I mean, similar questions, you could group them together and then maybe even do a Google Doc, and then after the live I'll edit them and put them in the description and those types of stuff. And that's kind of how that is. So Randall, I have I haven't, as you see in my videos, I do the same things. In the beginning I go, ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. And then at the end, I send you off with the same greeting. I hope, again, as well as often, I haven't done this in such a long time, but if this is your first time to my channel, welcome. I hope you stay. Have a good day. How's that? Bye. Be good. Let me go answer that phone call. Randall, have a wonderful, wonderful night, and I will see you at our meeting tomorrow. Let's see, probably here. I'll have sunlight. I usually sit here because there's a window here, some nice sunlight, and that type of stuff. And watch, I'll turn off all my lights. You see how dark it is. Look at that. 1, 2. Woo! Lighting. Oh, lighting. Oh, where's Randall? Okay. Ring light. Have a good day. Bye-bye.